You know, many people have been dealing with so much over the past week. It's really taking an emotional and mental toll for many people.
That's right, and so many people are going to be dealing with this grief and this pain and suffering for a very long time. Joining us now live to talk more about the mental toll and the help that's available right now is Dr. Daniel Nead, Integrated Health Director at Mālama Ikeola Health Center. And thank you so much for joining us, Doctor. You know, we want to ask you, as people deal with this unimaginable tragedy and loss, what kind of mental help is available right now to folks?
I think anyone who's looking for help locally can reach out to any of the number of mental health organizations that may be in their area. Organizations like the National Association for Mental Health. Here on Maui, we have places like Maui Counseling Center, Aloha House. I would also encourage people to talk with their primary care provider who may be able to help identify resources, as well as to reach out to your insurance company. Behavioral health services in Hawaii do not require a primary care provider referral, so people can actually establish care directly with anyone who takes their insurance.
And how many people have you folks helped so far in the wake of this disaster, and what kinds of issues are you seeing the most?
I couldn't give you a number. Things have been, as you can probably imagine, a little bit chaotic here on the ground. We're kind of trying to take anyone who is needing help, especially down at the shelters. I haven't been out to Lahaina myself, but what I've been hearing from my colleagues is sort of the things that we would expect from people who have gone through something like this. A lot of shock, confusion, fear, anger, and just the overwhelming sadness of losing so much of Hawaii's history. I think a lot of people are still running on survival mode as well. So we're also doing a lot of assessing for need kind of on a day-to-day basis as people are adapting and adjusting and the situation is changing.
Yeah, exactly. People are just still trying to process this. How important is it to have these types of mental health services available?
It's really important. If we think about medical emergencies, we train people to know first aid, how to kind of intervene in an emergency. And that's a lot of what we're doing right now is what's called psychological first aid. It's sort of doing that stabilization and triage, kind of providing people the support, the care. It's not therapy per se, but it is a way to sort of prevent people from burning out just from being in survival mode so long, so that in the long term, as this goes on, they're coming more from a place of strength and not trying to struggle just to get through the initial event.
You know, it's not just folks who lost their family members or their homes. This is really affecting so many people throughout the state. What advice do you have? What can they maybe do on their own to deal with the pain?
I think the first thing to know is to remember that it's okay to feel traumatized after a traumatic event. That is the normal human response. So to feel anxious, to feel sad, to notice that your sleep might change, your appetite might change, that's all the normal expectation of going through something that's sometimes so overwhelming, our brain literally doesn't know how to process everything at once. The other thing would be to get back to normal routines. It can feel a little strange and it can bring up maybe some survivor's guilt for people, but being able to get your brain, your body back into the routines and the patterns that it's familiar with can really give back a sense of predictability and safety that is really important going forward for people to be able to maintain their resilience. And then again, not to feel afraid to reach out to a friend, a family member, a spiritual leader, or a formal healthcare provider, just to talk about things or ask questions or get support or more information on something if you feel like it's getting a little more than you may know what to do with.
Yeah, so important to talk about and let people start to try and heal. Thank you so much, Dr. Daniel Nead, Integrated Health Director at Mālama Ikeola Health Center. We really appreciate your time.